Finishing up my last week of pathology. So far, it's been looking at a lot of slides every day, day after day, day after day. And my preceptor, he's kind of old. So, by the time it's time to go, he's looking at 10 slides, which might take us about an hour or so. But it's been very chill. Actually, the first week I was doing pathology, I was like, I should have just applied here because you have a lot of time where you're not rushing it from patient to patient. It seems like you kind of get to go at a pace that suits you. However, now at the end of the rotation at my fourth week, you just start to miss the patient interaction. You're constantly looking at the slides, your eyes hurt. It just gets boring after a while. Um, at this time, I'm trying to finish my PTAL. I don't graduate till, I don't finish my rotations till April 20th. Um, and I have to complete my PTAL by the time I start residency in July 1st. Sometimes PTALs have been known to taking up to 2 to 3 months to complete. Oh, the PTAL is what you need only in California because, of course, California has to be different. Um, they get cash. We have to cash out about I think $600 or something for an application that only applies to California. If you're applying to California residencies, they want um, a specific, I don't even know what it stands for, but postgraduate application documenting that you have finished all your rotations. You have to make a specific L6 form for each rotation, which documents it has to get signed by the person who's over the medical education, and that process can take a while. And you're not able to start residency in California until you have finished this PTAL. No other states have anything similar to it. It's just, California's hustling us. So I got to get on that quickly. So I'm going to turn that into the hospital I'm rotating at now and the hospital that I did my core rotations in so that I have time to process my file. It's going to be really close, honestly, by the time I start residency, but I hope that everything will um, get in. Other than that, after this, I'll start OB-GYN, so a lot of babies and mothers. That's something I felt like I was weak at when I was doing my core rotations. I didn't, I had to retake that shelf exam to begin with because I failed it the first time, so retook it. So I feel like that's one of my weaker points. I wanted to definitely end with OB-GYN going into residency, so I feel a little bit more comfortable. Um, just getting better with my pap smears, um, getting used to what tests the mothers will have to do at a certain amount of weeks, and just getting more exposure with deliveries and everything, and getting a chance to be involved with more of the cesarean sections as well. Other than that, I'm just pretty much chilling. I finished the complete season of Stranger Things in Spanish. I've been trying to brush up on my Spanish. A lot of the places that I interviewed with are heavy Spanish-speaking population, so um, I have a tutor that I meet with once a week, trying to just get down some of the. I do know some of the basic medical terms, but I just want to increase my fluency and be able to converse with these patients because sometimes it gets a little bit um, clunky, and also whether the reception is good or not when you're using the translator phone. So um, I kind of just want to be able to know exactly what the patient was saying and have them understand me. So that's something I've been working on, and hopefully I'll make a lot of progress with that until July. Um, and the good thing about this rotation is part of the reason why I chose pathology now is just because you have that extra time to work on things like this. And just hang out around LA. Although it's been unusually cold here, it was raining today, and which it never rains in sunny California, so getting used to that and preparing for a wedding. Um, Part of the reason we decided to do the date of June 2nd is because I knew that in residency I wouldn't have as much time as I wanted to um, plan a wedding and hang out with the guys for a bachelor party and do the honeymoon and stuff. So I figured it would be a lot better to do it before I started residency. However, that also means that we're rushing kind of to get things together. Luckily, she's been taking care of most of it along with the wedding planner, but still, there's things such as finalizing the guest list and which people were going to go with as far as decorations and the budgeting and stuff. So that's been another thing that I've been doing. But overall, I just feel really um, blessed and fortunate to, no matter how the match turns out, that I'll be graduating soon. We find out where we match on March 12th, which is in 2 Mondays from now. And then that Friday, I believe, we find out where we're going. It's always tough explaining it to people because you tell them it's not like a regular interview, where you find out a couple weeks later where you're going. So people are constantly asking me, well, did you get the job? And I tell them no. They send us a letter one day and they tell us where we're going. That can be anywhere in the United States. In my case, in California, but for the majority of students, anywhere in the United States. So just waiting on that. Constantly praying. Just hoping that I end up in whatever place God wants me to be at, and just trying to make sure that I have all of my X's crossed and my W squiggled before residency starts. That makes no sense, but and in addition to that, that's about it. We have graduation on May. I don't remember, but we have graduation in May, and so during that time, me and my fiance will be spending a week in Miami. So make it into a little mini vacation since we'll be out there anyway. And then from there, just getting close to residency. So this is really a good time, I think, in the fourth year. Everything, once interviews are done, everything slows down a little bit. So, I don't have to worry about shelf exams. I'm just studying for my own enjoyment. And especially on this rotations pathology, when I get home, there's no patients that I really have responsibility for, which just gives me time to do a little bit more of what I want. My hours have been from Tuesday to Friday from 10 to 4, and I'm at the California Hospital Medical Center in Los Angeles. So that's about all I want to say.